Hello, this is Dr. Eric Bricker, and this is how health insurance works. Today's topic is the EOB, otherwise known as the explanation of benefits. Now, the EOB comes from your insurance company, and it'll either come through the mail, or you can get it on your insurance company app, or you can get it through the insurance company website when you log in. And an explanation of benefits is created every time a claim is filed. In other words, every time you use your insurance company creates one of these things. Now, when you get it, it's really hard to understand. So I'm going to show you what you need to pay attention to in the EOB. So one, it's going to have the name of the doctor or hospital or the lab where you had service. Now, you might not recognize it. So the first thing that a lot of people say is, that's wrong. So what you want to do is you want to look at the date of service, because that will be right. And you're going to ask yourself, okay, did you actually receive care or have a visit on that date? And if you did, it's probably correct. Next up, the amount billed to the insurance company by the doctor or the hospital lab is going to be listed as well. You look at it, you say fine, you move on. Next, you're going to see the insurance discount or the denial. So this is important because you're going to want to see if the insurance company is going to apply their discount or if they're not going to do anything at all. And if they're not going to do anything at all, chances are you're going to get a bill for that full billed amount from the doctor or the hospital. Okay, so fine. Let's say there's a discount. Fantastic. Now, will be the amount that is paid by the insurance company. And that amount might be the total amount that's left, or the amount paid by the insurance company might be zero. Because let's say you haven't met your deductible yet, so you might have to pay all of it. And then finally, the next part beneath that is the amount you owe. So obviously, that is a very important part. Now, almost 9 times out of 10, it is more than you think you're going to owe. Now, I do this every day, and whenever I look at an EOB, it's still more than I expect it to be. Now, I don't throw my EOBs away. I hold on to them, and what I do is I then compare them to the bill that I receive from the doctor or the hospital. So I'm going to compare them. Sometimes I'll get the bill first and I have to wait for the EOB. Sometimes I get the EOB first and I have to wait for the bill. But then I compare the two, and I ask myself, okay, is the amount that is on the bill from the doctor or the hospital equal to the amount that the EOB says that I owe? Okay, and if it's the same, then, and I have a problem or I have an issue, I don't think that's right, then I'm going to call the insurance company and I'm going to ask them why. Now, if the amount on the bill and the amount on the EOB in terms of what you owe is different, then you're going to call the doctor or the hospital and you're going to ask them why there is a difference between what the bill says and what the EOB says. And in another video, we will talk about how you go about fixing that. But this is the first step in terms of understanding EOBs. And that's how health insurance works.